to prevent the actual mass tumor from growing. So, there's other options besides just surgery and radiation. There's other things that can be done during these times.
Dr. Mariella Hession, thank you for being with us this morning.
Oh, of course. Thank you so much for having me.
It's Dr. Mariella Hession. She is the medical director of breast imaging for RadNet Imaging Center based at Los Coyotes Imaging and Women's Center in Long Beach. And, we're talking about mammograms, especially during COVID-19. Might seem like a different kind of way to have to handle it, but you know what? Basically, it's your health, and you can't ignore it. In a moment, we'll continue. Thanks for listening to Tuned In.
Right now, we all feel a little disconnected. For seniors living alone, the isolation can be overwhelming. Connect with an older loved one and have the conversation of a lifetime at StoryCorpsConnect.org/AARP. A message from AARP, StoryCorps, and the Ad Council.
Tuned in from Mount Wilson FM broadcasters and Global Jazz Incorporated. We are spotlighting health this morning, and of course, the COVID-19 that is so prevalent everywhere in the world, and that can lead to some confusing ideas and thoughts. And to help clear the air a little bit this morning about one particular section of that is Dr. Mark Kerner. He's with Cal West Head and Neck Surgical Institute. He's based in Northridge, and we're going to talk about the differences right now between sinusitis and COVID-19 symptoms. And Doctor, good morning.
Good morning. Thank you for having me.
Thank you for being with us. And I've heard this from a few people who have had what they consider to be, quote, the common cold. And, of course, because of the heightened sensitivities to COVID-19, people sometimes think maybe I have COVID-19. What's the big difference between having a normal sinus problem versus having COVID-19?
Sure, very good question. So the coronavirus, the novel coronavirus that's causing the COVID-19 disease, is actually a cousin to the coronaviruses that cause the common cold. So there is some overlap with the symptoms, and some of those symptoms can also be seen in sinus disease as well. So classically, we've been talking about the COVID or coronavirus infections as causing fevers, cough, and sometimes shortness of breath. But we now know there's a lot of people that have had it only with some minimal symptoms, including loss of smell and loss of taste, and that can be seen in sinus problems as well. So typically with sinus problems, we'll have congestion, postnasal drip, a runny nose, maybe some facial pain or pressure, symptoms that are not typically associated with the coronavirus infections.
And when the concern that, of course, has become so heightened because of COVID-19, people, of course, want to make sure they're doing the right thing. I think fundamentally where you begin with is if you're not sure, you have to get yourself checked out, don't you?
Right. And now we've got pretty widespread testing available to everyone. So if you really thought you had those symptoms, and again, those symptoms would be primarily a cough or a low-grade fever. Now, only about 50% of people with COVID have really had fevers, but obviously fever is one of the symptoms and one of the traditional symptoms, or an acute loss of smell or taste that's not associated with anything else, then I would suggest somebody get tested. Now, if you're just having a typical seasonal runny nose, some congestion, some itchy eyes, you don't necessarily need to be tested for COVID because it's still going to be highly unlikely that you had it.
Making sure that you know your body, of course, is paramount with any illness, of course. When you see patients that come in to see you and have concerns, do they seem to have more of a mindset that I have to have COVID-19 because of all the press that's being generated about it?
Well, there's clearly a number of people out there that we're seeing and on a regular basis that are concerned and think they've had it. Either they had a pretty severe upper respiratory infection or a flu-like illness this year, and we're pretty sure they had it. And we've been antibody testing, and we're also nasopharyngeal testing patients too, and we're actually finding a relatively low rate of people with antibodies. So, and some of those that we've tested that have been positive have actually been completely asymptomatic. So they never even knew that they had an illness or, that would be suggestive of this. So, but most people who have allergies have had them for a number of years, and they do know the symptoms. And so, at least in our patient population, they know when it comes on, they know it's the typical seasonal, allergy-type symptoms, which is the congestion, runny nose, postnasal drip, itchy eye kind of symptoms, and whether they're a little bit better or a little bit worse, that's something that we're certainly seeing a lot of right now.
It's Dr. Mark Kerner of Cal West Head and Neck Surgical Institute. He's based in Northridge. This is Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated, and we are discussing this morning health-related issues, and specifically here with Dr. Kerner, comparisons between COVID-19 and sinusitis. Doctor, just to get away from COVID for a moment here, sinusitis has been such a thing with so many people for so long. Have you seen the whole sinus issues that have been in the world getting worse as time goes on, or are they sort of plateaued?
Well, I think, we are seeing sort of a slowly rising incidence of sinus infections, and I think a lot of that's environmental. So whether it's chemical irritation, allergy types, allergies that lead to prolonged recurrent sinus infections, anatomic issues. So there's a whole myriad of reasons to have sinus infections, but we think a lot of the fact that we're seeing sort of a rising incidence is related to environmental issues. So people are allergic, they either have chemical sensitivities. We used to see a lot of that when there was a lot of smog in the air. That's actually gotten a little bit better.
Right.
But we still have, those kind of irritants. And those things, what they lead to, they lead to swelling, and then they lead to blockage of the small passages that our sinuses drain through that get into our nose. So it doesn't take much swelling and much irritation to cause blockage of any of those sinuses. And when you get the blockage, that's when you end up with the infections. And then the subsequent symptoms, which is that facial pain and pressure, congestion, postnasal drip, runny nose, you blow your nose, and you've got purulent drainage. So that's the typical pattern of a sinus infection. So we use antibiotics to help clear that infection. We're big fans of nasal irrigation and nasal flushing, because that then helps our sinuses, the sinus mucosal layers, clear themselves and helps clear those small sinus openings. And then we use things like nasal steroid sprays, which are now over the counter, like Flonase, fluticasone, which also cause a reduction in that swelling, which helps those sinuses drain.
I remember when I was a kid, there was a thing called a neti pot, which would be used by generally older members of my family. Is that still relevant today, or is that sort of yesterday's technology? No,
absolutely. I mean, it's still a valid way to irrigate your nose. You just have to turn your head and then sort of allow that to come in, sort of flush it in one side, let it go out the other. I like to have our patients use the bulbs or the bottle sort of irrigators. I think they're a little bit easier, a little less messy. There's now some other commercial devices on the market, which I have no financial interest in, but like the Navage, a little bit more expensive device that actually has a suction attached to it, so as it's flushing, it also suctions that out, so it makes it a little bit more comfortable. So you can either use one of those devices. Some people use a water pick on some gentle settings, and there's some nasal irrigator tips for that as well. So there's all kinds of devices out there. An neti pot is just one of those original old-fashioned devices, and it still works quite well.
Dr. Mark Kerner is my guest. He's with Cal West Head and Neck Institute in Northridge. This is Tuned In from Mount Wilson FM Broadcasters and Global Jazz Incorporated. We are talking about your health this morning here on Tuned In. Dr. Kerner, as we talk about the COVID-19 and the prevalence that it has, of course, come into our society here in 2020, when you think about all the patients that you've seen come through here in the last few months, since everything sort of took control of the world, for lack of a better term, are you surprised at the number, or is the number sort of kind of in your mind kind of in keeping with what you would expect from a pandemic?
Right. Yeah. I mean, I'm not that surprised. I mean, look, we have a lot of elderly people in society, a lot of people with a lot of underlying medical problems, and they're going to be susceptible to all kinds of infectious diseases. And having a novel viral infection that our immune systems are not used to, it's certainly going to affect those that are much more at risk, and which is exactly what we're seeing. Now, we're also seeing a trend now of having younger people test positive. So at the beginning of this pandemic, the average ages were up in the high 60s. It's now coming down. The last study I just read from the CDC and the health department is that now our average ages now are down in the late 30s. So we're seeing more people, but they're not as sick. So I don't think the virus is mutating into a less virulent form. I just think that the people that are getting it are not getting as sick. They're not getting that second stage of the disease, which is really what we're seeing with this viral infection, which is that first prodrome phase where they have the sort of fevers, low-grade fever, the cough, and the flu-like symptoms, which then progress to the pulmonary and pneumonia-type symptoms, where then it becomes a full-blown inflammatory process, which is why that part of the disease is actually improving with the use of steroids, which was just a study was just released that you may have heard about a day or two, where dexamethasone, which is a very commonly used steroid drug for inflammation, is actually helping those people. And we've been using that regularly since we've been seeing these patients on an outpatient basis as well. That study was done on the hospitalized patients, but we've been instituting that steroid treatment much earlier in the phase and have had very good results, in treating the mild patients as well.
From a medical point of view, and this might be a little bit off the page, but I'm going to ask you anyway. When things like this happen, and of course there's no playbook for what this is, I mean, there's not really a great lesson that we can compare it to. Is medicine sort of playing catch up real quick, or is there work that just goes into things immediately to try to figure out the why right away? How does that work?
Well, I think, look, really, I'm going to actually disagree with you just a little bit on that, and that is that this isn't that novel. We know what respiratory viral infections are like, and we've had other outbreaks, just not in this country. We've had the SARS outbreaks, the MERS outbreaks, which are all sort of there are coronavirus-related pneumonias and infections. It's just that this one just became a pandemic.
Right.
But we've had those, and those were contained, and we know how those are treated. We know how those are spread. We know how those are treated. And actually, the original SARS that was present in the Asian countries was actually a much more virulent virus in terms of the mortality than this one. So the playbook really isn't that different. It's a respiratory virus. We had a bunch of sort of misinformation at the beginning of this outbreak that masks are not effective, which we felt was totally untrue, because most of this viral load is spread in the droplets, and the droplets are readily stopped by using a mask. So the viral particles may be small and they are small, we know they are, and they would actually transgress through most masks other than maybe the N95 mask, but for the most part, you need a very high viral load, and these studies are now coming out, especially from Europe and from southern China, or from the Chinese areas, where they're looking at what does it take to really get infected. And what it seems to be is something that we see with other respiratory viruses. So you need a pretty high inoculation load of the virus, and you need a prolonged period of contact. So we think 15 to 30 minutes of a very, very high viral load, which is what's causing the disease. And so that's